Now, of course, these statistics that we're reading coming out of the recently conducted surveys concerning as South Africans, we don't want our doctors to feel that they're working in an environment that isn't going to enable them to work to the best of their abilities. Why are so many South African doctors expressing dissatisfaction?
Yeah, Jerusha, I think I've said many times before that people shouldn't exclude themselves on the basis of their profession from the broader South African context. I think doctors are no different to many South Africans in many walks of life who are pretty concerned about the state of affairs in the country at the moment. I think there are enormous challenges we're facing. I needn't have to list those for you or your viewers. I think we're well aware of them. And I think sort of linked into that are the issues around uncertainty with respect to healthcare delivery, public and the private sector. I think far too often we tend to focus solely on the public sector as though it's the source of all problems. But there are enormous challenges in the private sector as well. And I think one of the key questions in the survey done recently was around the National Health Insurance Scheme, which is something that has been mooted now for very many years. It's been on the cards. It's clearly that this is government policy, and this is the policy they wish to implement. From the position of the South African Medical Association, it's something that we intrinsically support. The concept of universal access to health care is something that I think should be supported by all South Africans, and we certainly do support that position. The vehicle which government has chosen to do this and to achieve this policy objective is the NHI. But I think therein lies the rub. It's the actual implementation of how this is going to happen, the lack of detail that in fact is an added dimension to the uncertainty and the problems that the healthcare professionals, such as doctors, find themselves in South Africa at the moment.
Dr. Sonderup, won't you just go into a little bit more detail for us, those of us who are not in the medical profession and don't quite understand how the proposed government plans will implement or will impact your day-to-day work? What is it about these proposed plans that many doctors are saying are simply not feasible?
Well, I think what is the real problem, and therein lies the way I can try and answer your question, is the actual lack of clarity and the lack of detail that's creating the uncertainty. So the idea of a national health insurance scheme and national health insurance was introduced already back at the 2007 ANC conference in Polokwane. One of the adopted principles was that South Africa would have a national health insurance. It wasn't really until 2009, 2010 that the first so-called green paper was actually put forward by the Department of Health in terms of what the actual broad structure of this NHI would be. And extensive time was given for input into that green paper. And we've really all been waiting for the last 5 years for the so-called white paper, which really would be the nuts and bolts of the system. Now, I think many people would recall that the idea at the time was that government wants an NHI up and running by 2025. That's only 10 years away, and it's a pretty big effort to actually bring about a national health insurance scheme or a national health system within a decade. So I think there's a lot of talk about it. There's unfortunately not much detail, and that's creating the uncertainty. I think I have to be truthful and say that there have been a lot of attempts at trying to breach some of the issues and start to deal with some of the issues. And as you may well know, there were 10 pilot projects set up about 2 years ago by the Department of Health in 10 districts in the country. That was eventually expanded to 11 districts to run so-called pilot NHI projects. And these have been up and running, but unfortunately, when you look at it critically, many of the projects have not really come to fruition. And recently, Treasury reported that in many of the pilot sites, in fact, the budget hasn't actually adequately been spent yet. So it's quite disappointing. But at the same time, those of us who feel this is the correct direction in which to move would really want more certainty and just more nuts and bolts, so we can start wrapping our head around it and looking at the really difficult questions. The biggest one, of course, is how we as a country are going to fund a national health insurance system. So it's a complex task, but let me just finish off by winding back again to the original issue, and that is the concept of universal access to healthcare and the principle of universal access to healthcare. And that is something I think we should be supporting as South Africans, and we should look at all mechanisms to actually achieve that. But it's going to be a very tough task.